Greetings, I am your pharmacist, Dr. Tammy Lee Demler. We've been in the classroom before. I hope that you've liked our previous recordings, and this is a new one that I think what you'll enjoy because most of us have used topical creams and ointments before, and whether they're medicated or not, my guess is that you've probably tried things over the counter, had your doctor prescribe one of these products, and just to be able to understand the difference makes it a little easier for everybody. So let's get this started. And we're going to talk about the following things. We're going to talk about why use a topical medication, what is a cream, what is an ointment, how much do I use, and maybe what else is there, what else do I need to know. So let's start with why use a topical medication. So skin-related health conditions affect millions of people around the country and across the globe, right? They can range from symptoms like itching and swelling, rashes, and the rashes can be mild or severe. Now, I will add that if ever you have a rash and you're on medication, which would be most of all of us, you'll want to make sure that before you try to do anything over the counter, that you let your pharmacist or doctor know that you've got a rash and let them check on the medicine that you're on. There are a few medications that can cause rashes that can be serious, so we need to make sure that we're ruling out a drug-induced rash. Many topical medications are available to treat symptoms. They can be ointments, creams, lotions, and more, and we'll talk about those. The best topical medication really is different for everybody. Your skin type, the condition that you're being treated for, and your medical history all play a role. And at the end of the day, sometimes you can have a preference. So a medication can be available in a number of varieties of products, and maybe you could be part of that choice. So a cream, what is the cream? I have a picture here that shows you a cream. It looks like toothpaste. It is opaque. You can't see through it. It's a cream like whipped cream would look like. You can't see through it. And we're going to talk a little bit about what makes a cream a cream. So creams, when you compare them to ointments, are not as heavy and thick. They're lighter. They also tend to have more cosmetically appealing a cosmetically appealing appearance to them that once you rub them in, you can't see creams, whereas that's not the case with an ointment. Now there are advantages and disadvantages with creams, as there will be disadvantages and advantages with everything we'll talk about today. But creams have a really good source of lubrication. They tend to be fairly hydrating, but they're not as hydrating as ointments. But they're still a good source of lubrication. Cosmetically, they're more appealing. They're less greasy than ointments. They're good for skin conditions that ooze or crust because they allow that area to breathe a little bit more than an ointment that really covers and almost like a Band-Aid occludes the area. Easier to spread over large areas, less hydrating than ointment. So if you have a large area, a cream is a good thing to apply because it makes it a lot easier to move it around. Can you think of a skin condition that may ooze or crust? I can think of a few. One is chicken pox, right? Others can be different type of viral outbreaks. Like you can get cold sores and that sort of thing that tend to crust and ooze, so creams would be generally better for that. You want them to dry out. Disadvantages, generally they're less potent than ointments, but that may not be a bad thing. So when it comes to steroids specifically, creams may not be as strong as maybe you would be needing, and so an ointment would increase the how would I say, the potency of that medication. Even the same percentage of the medication in an ointment can be a little bit stronger. More likely to contain preservatives that can cause irritation and stinging. If you look at an ointment, it can be Vaseline as a base, where creams need a little bit more finessing to be able to make them last long enough. So they can possibly be more irritating. And you're not able to form a thick protective layer with a cream. So those are disadvantages. They kind of blend into the skin and disappear. Ointments, we talk about an ointment. You can see on the lady's finger there that it's Vaseline. It's a Vaseline base or something that's similar to that. But it looks like that. It's translucent. You can see through it for the most part. They tend to feel greasy. Skin can appear glossy after you apply it, shiny with the ointment. Ointments are usually thick and heavy, and they are also usually able to provide a thick barrier of protection on the skin. It doesn't really allow a lot of air to get in there, so the protection can be important depending on what you're being treated for. So the differences in appearance and texture is really are based on the amount of oil and water. Ointments contain 80% oil, whereas creams tend to have 50% oil, and it's a chemical balance that then becomes the important part there. Ointments advantages, they tend to be stronger than creams, so you can have the same percentage, but with an ointment, it can be based on those symptoms I described and then a little stronger. It's good to have a medication that needs to be absorbed through the skin because of the strength and the potency and the barrier that it protects and causes. Good source of skin lubrication, they tend to be hydrating, and they have a thick protective barrier that they can provide. And because it's like a Vaseline, they can have fewer preservatives. Generally, I'm not thinking about that when I'm thinking about which is preferable, but it's important to some people who might have more allergic potential. It's hard on hairy skin, so ointments get kind of greased up and it gets kind of sticky with the hairy skin, so if it's a hairy area, ointments are difficult. They have a greasy appearance, you can see them, so they're not preferred for cosmetic reasons. They're hard to spread over the skin, it takes a lot more effort, and hard to wash off. Some can be really water impermeable, and not that ointments can't, but not that creams can't, but ointments can sometimes be more likely to cause stains on clothing and on fabric. So this is a demonstration on how to use the products that we spoke of. This is a great video, I think, that will help you be able to navigate through that, and I'm hoping it'll just get started.
Well, hey guys, welcome back to the Q&A. In today's video, I wanted to address a topic that I get many questions on, and that is how much of a cream or ointment should be applied or should be used on certain areas of the body. This video is a follow-up to last week's Q&A wherein I talked all about topical steroids, discussed their common side effects and indications, as well as how topical steroid potency is influenced by different factors. So if you missed that and you're tuning into this video for some information on amounts of topical steroids, make sure you check out that video first. I think it will have some information that is helpful to preface this video. But today I wanted to go over just some general principles of topical creams and ointments, such as what you might have in your steroid creams and ointments that have been prescribed to you by your treating healthcare provider. Now, as with all of my videos, the information in my videos is intended for general information purposes, sort of like the type of information that you might find in a pamphlet while you're sitting in the doctor's waiting room. You know, general audience. This is not information that is intended to replace the advice of your treating healthcare provider. So any questions that you have about applying topical creams or ointments that have been prescribed to you, first and foremost, direct to your treating healthcare provider. I can't answer those for you. But in today's video, I just wanted to go over some general principles of how to use topical creams and ointments, such as a prescription steroid cream. And again, as I said last week, topical steroids are prescribed for many different types of skin conditions, most commonly types of eczema and dermatitis. And as I said last week, the potency of the topical steroid is influenced by a variety of factors. It is influenced by the individual steroid molecules, so hydrocortisone versus triamcinolone. It is influenced by the area of the body where the steroid is applied. It is influenced by the vehicle that the steroid is in. In other words, vehicles that are ointments, thick and greasy, like Vaseline, for example, tend to be more potent than things in lighter lotions and watery vehicles. And the reason for this is that ointments are more occlusive and help to drive the active drug, the steroid molecule, into the skin. And then the other principle of topical steroid potency that you should also be aware of is that when applied under occlusion, like under a bandage, under a sock, under a glove, under a shower cap in the scalp, steroid potency also increases because that extra occlusion on top of that further drives the drug into the skin. So that's something else to also be aware of as I go over some just tips and pointers and information about applying topical steroids. But topical steroids are absorbed at different rates depending where on the body they are applied. On the thin skin of the eyelids, in the genitalia, and under skin folds, such as in the armpits, under the breasts in women, in the abdominal fold area. They can be also absorbed at high rates because those are areas of occlusion or areas of very thin skin. Whereas on the thick skin of the palms and soles, absorption is very, very low, and oftentimes mid-potency or sort of, mid-tier strength steroids are completely useless on those areas. So bear that in mind when directing your questions to your treating healthcare provider about the location where the topical steroids should be applied. But if you've ever been given a prescription for a medication, oftentimes it's pretty straightforward. If it's a pill, take one pill by mouth a day for X number of days. And we learn how to do that as a child. You swallow the pill, boom, very little thought goes in. But when you get a topical cream or a topical ointment, it is far less straightforward. It says apply a thin film to affected area daily or apply a pea-sized amount. Very, very confusing. So this is one concept that I wanted to share with you all that I find to be incredibly helpful. It's what I use as a dermatologist, and dermatologists largely use to determine dispensing of topical creams and ointments, as far as how much to dispense in the on the prescription, and how many refills and the frequency of use. It kind of helps guide that. So, for example, if you're taking a pill by mouth, the provider may say take one pill a day for 10 days. They'd probably dispense 10 pills and then you'd be done with it. They're not going to dispense 100 pills. Likewise, for dermatologists, we're not going to give you a biggie-sized tube of a topical steroid that you're only intended to use for a short period of time in a very, very defined location on the body. That could be dangerous to give you too much, and then that goes to waste. So dermatologists and other healthcare providers are very strategic with the quantity that they dispense as well as the number of refills, because oftentimes it is the intention with a prescription for a steroid cream in particular to start out with a strong formulation for a short duration of time, have the individual come back for follow-up to make sure the disease has responded appropriately to the treatment, and then aim to switch to a different, less potent steroid to kind of help wean the individual off. So it's very strategic as far as how much is dispensed and the number of refills. They're obviously not going to give you a bunch of refills, because if you don't come back and follow up, then you've got all this really strong steroid out there, potential for adverse side effects. So that's just kind of what goes on in the dermatologist's brain when they are dispensing medications to you in cream or ointment forms. But in general, one little principle that I think is very helpful and what we use is something called the fingertip unit, okay? So a fingertip unit refers to, on an adult finger, I'm specifying an adult here. In general, an average size adult, women are obviously a little smaller than men. A fingertip unit refers to the surface area on what's called the volar surface of your index finger. The distal phalanx, okay? So from this line here on your index finger to the tip, all right? And if you've got a long nail, it doesn't extend the entire length of the nail. It stops where the skin stops, okay? So that is one fingertip unit of ointment or cream. So let's just see what that looks like. This is an over-the-counter hydrocortisone cream, 1%. One of the weakest steroids out there, why it's available over the counter. All right, so there you have it. That is roughly one fingertip unit, all right? One fingertip unit on the average adult, male or female, is roughly 0.4 to half a gram of the cream or ointment, all right? So this is about a 30-gram tube, so I could do this 60 times and then it should be done, all right? So that gives you a rough estimate of that. All right, so one fingertip unit on an adult is about half a gram of cream or ointment. How far does that go? 1 fingertip unit equals half a gram of cream or ointment, can cover on the average adult, male or female, the entire surface of the hand. The entire surface, both sides of the hand, all right? Everything you're seeing here and everything you are seeing here. Not the wrist, the entire surface of the hand, okay? Or, all right, or it can also cover one surface of both hands. All right, so if you just have a rash on the top, completely covering, if you have a confluent rash on the entire surface of both hands, that must be miserable. 1 fingertip unit should cover that entire rash, okay? That's rarely the case, right? So you can imagine you really don't need a whole lot of a cream or an ointment to be applied effectively onto the area. That gets you a good thin film of treatment to the targeted areas. More is not better. Using more is not getting you more cream, it's not getting you more drug. And applying more, doesn't increase the strength. And for topical medications, particularly in cream or ointment forms that are very occlusive, you don't need a huge heaping glob on there. You only need a very, very thin film. So, again, 1 fingertip unit to the entire hand will get you a thin film of the medication at an effective, at its dosage, basically. Heaping more on does not increase the strength of the steroid. That is a misconception, that if you just pile on more, it will increase the strength. It doesn't, okay? Steroids don't work like that, okay? So just know that 1 fingertip unit will get you both sides of a hand, and heaping more on there isn't going to be helpful, or heaping more on there is not helpful, and you'll just burn through your prescription pretty quickly. All right, so if you have been advised, for example, to cover your entire hand once a day for 10 days, a 15-gram tube of cream or ointment is likely what is going to be dispensed. That's one of the smaller tubes. That should be more than enough. All right, so if you are buzzing through it faster than that, you're using too much and you're wasting it. All right, so that's likely the size that would be dispensed, roughly a 15-gram tube for 10 days of once a day application to the entire hand. Chances are you don't have a rash covering all the surface of your entire hand, so it should last more than 10 days for sure. You really only need a tiny amount. Now, 2.5 fingertip units should cover the entire face and all surfaces of the neck, as well as the ears of the average adult male or female, and that's roughly at 1.25 grams of cream or ointment. Now, for the trunk or the body, excluding the arms, excluding the neck, to cover one side of the trunk, meaning your entire back or your entire chest and abdomen, you need 7 fingertip units to cover that entire surface. So if you've been advised to apply the medication to the entire back, then it should take you 7 fingertip units, or 3.5 grams per application. One arm, your entire arm, so from about here to stopping at the wrist, is 3 fingertip units for one entire arm. One entire leg is 6 fingertip units. And then, unlike your hand where you got away with 1 fingertip unit, your foot is generally larger. That is about 2 fingertip units to cover the entire surface of the foot. So I will put these little measurements down below in the description box. And to give you a point of reference, to cover the entire surface of an adult male, on average, it takes about 20 grams of a cream or ointment to cover every surface. Now all of the information that I've gone over up until this point has been exclusively for adults. meaning adult index fingers and adult bodies, not children. This is very important. Children are smaller and they have less surface area. So fingertip units are going to be different in children based on their age, roughly. And so in the description box, I will list below some relative fingertip units in different age groups of children. But those fingertip estimates in children based on age are still using an adult fingertip unit. So meaning if you are a caregiver of a child and you are applying their topical medications, this refers to your finger on their bodies, not their little finger on their own bodies. And within that set of information, I will specify children and children, not infants. Infant skin is immature and absorbs topical medications much more at a much higher rate than children, and significantly higher than adults. Their skin barrier is still forming, and therefore these quantities do not apply to them. And best to discuss from the get-go if you have been prescribed these for an infant or young baby, best to discuss explicitly with the treating healthcare provider where, how much, and how frequently. So check in the description box. Again, I will list below the information on the fingertip units for using an adult finger for adults and then using an adult finger for children. And hopefully this helps you to understand a little bit of the logic behind how these are dispensed in terms of how the prescriptions are written and why you are always given such a tiny tube. Oftentimes people say, they only gave me this tiny little tube, like how I used that up and nothing flat. Well, chances are you were putting on way too much or putting it on too thick. I think the logic is easier to follow for an oral medication. So for example, if you have ever been prescribed an oral medication like an antibiotic and the provider wants you to take 1 pill a day for 14 days, we'll just say that as an example, they're going to dispense 14 pills. They're not going to dispense 100 with 3 or 4 refills. You're supposed to take it for that amount of time only, and then they either want to see you back to make sure you got better, or it's assumed that you got better if you don't come back. And the same sort of rationale holds true for how dermatologists dispense prescription creams and ointments. They give a small amount for an indicated amount of time to a specific location. And the logic and rationale behind dispensing prescription creams and ointments follows a similar vein, but for you as the patient or user of these, it's not as straightforward as swallow a pill. It's apply this. How much do I apply? It's not as packaged as a pill. It's not encapsulated, and that really is a tricky area to navigate. So I hope in my intention in making this video is to give you some general information about how it is that topical creams and ointments, particularly steroids, are dispensed, and how to apply them, and how much to apply them to cover a target area of the body. And again, as I said in the beginning, always be sure you go over all of this with your treating healthcare provider. This is merely intended to be general information to be helpful, but not as a replacement for the advice of your treating healthcare provider. But I hope this video is helpful to you all. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.
Okay, so that was hopefully of interest to you and being able to see a little demonstration there. So we have also, what else? Lotions. Lotions are more liquidy. They have a less amount of grease and leave very little residue. They can be used on hairy areas also. Good for the skin, again, conditions that crust or ooze, easy to spread over large areas. It is really the least hydrating version of a topical product. Less potent than ointments and creams. So again, if you had them all lined up and they're the same percentage, this would be the lesser of all of the strengths as far as the potency, and not able to really form any kind of thick protective coating at all. What kind of skin type might be best for these products? Again, it really depends on all of the things that we're going to talk about at the end of our wrap up here, but normal skin can use almost anything. Cream for adults that are older than 50 generally, lotion for younger adults potentially, generally speaking. Dry skin, cream or ointments. Dry, thick patches of skin, ointments are better. Oily skin, creams or lotions. Dry and oily skin, creams and ointments for dry spots, but no product on the oily spots. So it's important to be able to, know, not for the oily skin, you're going to have to be able to determine that, right? Dry and oily skin, it's a combination problem there. And hairy skin, creams or lotions are both possibly fine with that. So anything else I need to know? Can you combine ointments, creams, and lotions? Generally, while many products can be prescribed for this condition, maybe it's the same skin condition, it's best to not apply them all at the same time. Sometimes if you have eczema, you might have a steroid medication and then also a lubricating moisturizer. If you put a moisturizer on the skin first and then the medicine, it may not permeate into the skin. So the medication first and then hydrate later. And it's recommended that it be separated by a half hour if possible. Depending on your skincare routine, you might want to be able to get guidance on how to apply, how to wash, how to clean, how to let dry out. And then which topical medication formulation is best? When it comes to overall, it really depends. So one formulation isn't better than another, generally speaking, okay? The best topical medication will vary from person to person, and they're all tools that come in handy in different situations. An ideal topical product will depend on the following factors. Hopefully your preference could be considered, your skin type, medical history, where it's being applied. Remember the doctor just talked about skin folds and wet areas that may not be conducive to all types. Where your skin is being treated, previous experiences with topical medication if possible. Maybe you didn't react well with a cream or ointment and vice versa. I gave you some references to take a peek at on a QR code if you wanted to pull up this website. It gives you information from GoodRx, I think is where I got this information. And then what else is there as we're getting to our half-hour time here? There are other alternatives. So there are foams. So you might see something that comes out of a can like a mousse. This also lists mousses and gels. Shampoos, solutions, and suspensions. All of these things are vehicles for medication. If you have dandruff, for example, medication in your shampoo will help offset that. Sometimes it can be antifungal in nature. And that would be, it's applied as a shampoo, allowed to lather up, remain in the area, and then rinsed off very well. Solutions are very, very liquidy. It's even more liquid than a lotion, if you can imagine. So you may have used all of these, but they're all available for you. So that's where we come to the wrap up and review, and then we're going to be done with our day together here. So this is your question and answer time, and then your pharmacist will be up to do their activity. If not today, then maybe next week before the next time we do a topic. So which best describes a product that is heavy and thick, but tends to have more of a cosmetically pleasing appearance? Ointment, cream, lotion, or foam? What do you think? Okay, cream is right. Yep, it's more cosmetically pleasing because it rubs in and it doesn't look greasy. Next question. Which best describes a product that is heavy and thick and feels greasy? Your skin may appear glossy or shining after use. Which do you like, ointment, cream, lotion, or foam? Ointment, you got it. How about true or false? Ointments are less hydrating than creams. Ointments are less hydrating than creams. True or false? That would be false. They tend to be more hydrating. How about this? True or false? Ointments form a thick, protective layer that can help your skin heal. True or false? Ointments can form a thick, protective layer. True or false? It is true. Which of the following is true about ointments? Have the least amount of grease. They have the least amount of grease and very little residue. Can be used on hairy areas. Easy to spread over large areas. the least hydrating, or all of these are true. I'll give you a minute to think about that. I'll read them again. Have the least amount of grease, can be used on hairy areas, easy to spread, least hydrating, or all of the above. And actually, as I'm looking at this, the question really should have been about cream. So if anybody got this, all of the above, it should have been what was true about cream. So I apologize for that confusion there. I wasn't trying to fool you, but I just forgot to change it to cream. So scratch the ointment on that one. This is all true about creams, and make sure you make a note of that as you move forward with your activity today. So thank you for all of your attention, and we'll see you next time. Take care. Be well.